All right, we're back. Once again, Rhori Johnston in the chair for Open Line tonight. So pleased that Dr. Aimalohi Ahonkhai from Vanderbilt University Medical Center is joining us to answer our questions. That last phone call from Ellen, she raised a lot of concerns. And first of all, I do want to raise something that she said. I think it should go without saying that we know some of the higher risk patients when it comes to the coronavirus. We've said from the very beginning, I know we've connected, obviously obesity and diabetes are huge problems for folks, and other underlying health conditions. So she mentioned she doesn't hear a lot about, hey, lose some weight. We're saying that all the time. I mean, it's not just for coronavirus, but it's for anything and everything. You want to be as healthy as you can be, right?
Exactly. I completely agree with you. And that's kind of the focus of primary prevention and primary care, is really making sure we're focusing on overall health, good nutrition, good sleep habits, and reducing risk for those kind of common things in the U.S.
She raised concerns, skepticism about big pharma and the money involved, and she just, doesn't think that the right information is being released, that there have been some issues within the first 2 weeks. What do you say to her?
So, I'm not familiar with what she's describing within the first 2 weeks. I do know that for the trials that studied the efficacy of the COVID-19 vaccines, what they did was randomly assign people to getting the vaccine or getting a placebo, and then started counting the number of symptomatic infections 2 weeks after that dose was given, either of placebo or of the vaccine. And that 2 weeks was there because you don't expect the virus to work within that 2 week period. So it could be that she's talking about that 2 week period. I'm not really sure, but I'm not familiar with what she was describing.
So how do you convince someone like Ellen? I mean, she did say that she is open to, and she's obviously sounds like a very bright person who has done her share of research. Again, she didn't share with us, and we don't have time in this particular hour to go into it with her, of where she's getting all of her information. But she's definitely done research and has her concerns, but said that, maybe down the line she would consider it.
I hope that Ellen would go to her trusted healthcare professional. There is so much information out there, and I think it's my role as a physician to make sure all of my patients who I have a relationship with feel comfortable asking me and to clarify any of their questions, and for me to provide really competent information to them so that they can make good decisions. Yeah. There's just so much out there to wade through that's our role as gatekeepers of that information.
Now, I should point out, and I'm sure Ellen, who called in, and the other viewers know, this Wednesday at 4 o'clock in the afternoon, the city of Nashville, along with NewsChannel 5 and the other 3 local television stations here in town, we are all joining forces for a town hall called Controlling COVID, Ask the Experts. And we're going to have a panel where folks who are hesitant or may not, want to get the vaccine, we want to get their questions answered. So I hope people will tune in and listen to where this information is coming from, for sure. Let's go back to, let's see, Donna is on line 3, I believe. Hey, Donna. Donna, just turn your TV set down for us, or mute that and just go off the phone. Go ahead.
Okay.
Thank you.
Well, good afternoon.
Hi.
Hi, I was calling to check on the booster
Good.
and the flu shot. The both of them running close together, and I was concerned about how much time would you need to last in that?
That's a great question, actually. Thank you, Donna. Doctor, I think we did this story just earlier. Initially, I think experts were concerned about that, but now they're saying they're not as concerned about the overlap with the flu, right?
Right. It is safe to get them at the same time, and obviously it's much easier to get vaccines at the same time if you're in your clinic.
Right. So yeah.
So it is.
And not to diminish, flu season is is here. Influenza already starting now, I think, and the flu shots are going to be offered. So, yeah, go ahead and get it. Tell us a little bit of what you know about booster shots, Doctor.
Right. So I think that there are two things. One is there are people whose immune systems may not have been strong enough to really get the expected response that we want from vaccination. And so those individuals who may have abnormal immune systems, they may have an organ transplant, they may have cancer on chemotherapy, those individuals were recommending an additional third dose of the vaccine 28 days after their last shot. And those aren't really necessarily a booster. It's really to get the intended effect of the initial vaccine. For the boosters, we know, as we discussed, that protective antibodies, they decline over time, even from natural infection. And we know that that's true for vaccines as well. And if you remember, childhood vaccines, there are many vaccines that we recommend a booster dose for. And so now, as we have more information over time to see when does that initial immunity that we get from the first 2 doses of the vaccine, or one for J&J, start to wane, we're now seeing that anywhere around that 6 to 8 month period is where we may need to have a booster dose. And so that is what is now being recommended and will be rolled out.
Right. And for me, I have marked down January will be the, 8 months they want after the second dose, I believe. Right. And, so I penciled in January, and I'll call my doctor at that time or email and ask, what do you think? And go from there. So, real quick, another quick question that I had. Definitely, you mentioned the booster and the third dose. There was some confusion between the two. Pretty much the same thing, or no?
They're similar. I mean, I think that it's just a question of, if you have an abnormal immune system to begin with, may actually need 3 doses to get the response that we actually need you to get from the vaccination, versus your immunity kind of going down over time that needs to be boosted up again later. So it's a semantic difference, but
sure. Okay.
There's a slight difference there. Yeah.
And just wrap this up here. We just have 30 seconds left. I want to read something that I read about this late, with the FDA approval of the Pfizer vaccine, that Dr. Anthony Fauci says he hopes, right now there are 90 million vaccine eligible people in the U.S. who are still unvaccinated. He's hoping that this will convince, this official stamp of approval will convince as many as 20% of those 90 million. So, we're talking about 18 to maybe 20 million people. That would help a great deal if that were to come true, right?
It would help a tremendous amount. And I agree with Dr. Fauci. I hope maybe it's more. I hope so.
We'll see. Doctor, thank you for your time. We appreciate it very much.
Thanks for having me.
All right, we're going to take a break and wrap this up right after this, everybody.